I'm Paul from Kenya. Hii maneno ya vaccine, kwa maoni yangu, it's 50-50. Kuna watu wenye wanadungwa, alafu wanagojeka. Na kuna wengine wakidungwa wako sawa. So kwa maoni yangu naona iko 50-50. But juu ni moja tumeletewa, I hope tunaweza letewa zingine. We look whether they are better than the one we are using now. So it is my plea to the government.
My name is Pancras Kirori from Kenya, Kiambu County. COVID-19 is real. It's a real threat. I have witnessed relatives and close friends dying through COVID-19. I would like to advise my friends, relatives, and the whole country at large to get vaccinated, because this is the only preventive measures we can take. Let us heed to the advice given by our government. Let us go for the vaccination.
No, bado sijapata vaccination, lakini nitaipata hivi karibuni vile sina time niendea. According to me, naona mtu akivaccinatiwa hawezi pata COVID, itaprevent.
My name is Christopher Anderson Roberts. I'm from the sweet Caribbean island of Trinidad and Tobago, and I want to thank Africa Equity Media for this beautiful opportunity in sharing. I do not believe that if you take the vaccine, it would prevent you from contracting the COVID-19 virus. Reason for that is because the World Health Organization and the government of Trinidad and Tobago is sharing with us, the public, every day that even if we took the vaccine, it will not prevent us from getting the COVID-19, and it will not prevent us from ending up in the hospital. I work at the healthcare in Trinidad and Tobago, and with the information I have, it shows me that even if you contract the virus, and if you have already taken the COVID-19 vaccine, you can still end up sick and end up in the hospital. So my advice to anyone, that you shouldn't take the vaccine because it will not prevent you from getting sick and contracting the virus and ending up in the hospital.
A pleasant good day to one and all. My name is Preston George. I am coming to you and speaking to you from the beautiful country, Tun Island, Trinidad and Tobago, the land of the hummingbird, the steel band, and the best calypso and carnival in the world. The question was posed to me, if a person takes the vaccine, if it will prevent them from contracting the COVID-19 virus. The answer to that is that if a person is fully vaccinated, they will not, in fact, it will not prevent them from contracting the COVID-19 virus or any of the other variants. What has been shared with us by the government of Trinidad and Tobago, and it is well known in the news, that it will prevent you from dying. You stand a better chance of living if you are vaccinated than if you are not vaccinated. So my thing is, I will advise persons, especially those persons who may be vulnerable to the COVID-19 and the variants, to kindly and quickly get vaccinated, as we have the evidence. When the COVID-19 came in on the scene without the vaccine, it massacred the United States, Europe, and other countries in the world. Now that we have the vaccine, persons are getting sick, they are still dying, but not as before. So the evidence is there. Those of us who feel that, because people saying that you shouldn't be vaccinated, you should be vaccinated, that's a big argument and a big discussion all about. But based on the evidence, you will get sick, but you stand a better chance of surviving if you are vaccinated and fully vaccinated. Thank you, and I also want to thank Ms. Avalon Williams and Africa Equity Media for giving us in Trinidad and Tobago the opportunity to address you all. Thank you once again.
Hi, I'm Oral Saunders, and I'm from the beautiful islands of Trinidad and Tobago. I'm a union activist as well as a healthcare worker. And the question really is, if it is you receive the vaccines, can you still contract COVID-19? The simple answer is yes, you can. What we have been advised from our healthcare professionals as well as the scientists is that if it is you receive the vaccines, the risk, the likelihood of you becoming hospitalized and ending up in our HDU or ICU unit is reduced significantly. The HDU unit represents the high dependency unit, and the intensive care unit is the ICU units. Very limited capacities throughout the world. And our scientists and our health providers have consistently said we all can do our part in containing the spread of this virus by simply following the 3 W's. You wash your hands, you watch your distance, and you wear your mask. As a member of the healthcare team, we have been working at this virus for over a year. It has been very rough on many healthcare professionals. So what you can do in assisting us is following the 3 W's, and together we all can flatten the curve and eventually say goodbye to COVID-19.
Hi, my name is Daniel Wallace Linda from Zambia, LUSAKA to be specific. Do I think getting vaccinated would prevent me from contracting coronavirus? Yes, of course. The reason being is that's the whole purpose of the organizations for creating the COVID vaccine, so that people can be at less risk of contracting COVID-19. So I think the government should emphasize on getting vaccinated, use social media platforms, radio, for people to be motivated and inspired to get vaccinated. And of course it comes with many benefits, especially those that do international business. Other countries do not allow you to enter their country without a vaccine certificate. So I think people should get vaccinated, and let us prevent our families and friends from contracting coronavirus by getting the vaccine ourselves.
I want to add the voice, in regards to COVID-19 vaccine. Being vaccinated, I think, is not the only way that can prevent you from, contracting, the COVID-19. I would say no, to the fact that, we all differ in the immune system, and we've heard stories, even those people who have been vaccinated already, that they've tested positive. So I think I would say that's not the only thing that can prevent you from, contracting the disease. And under that, I think the recommendation I would say we just really need to adhere, to the health guidelines, demanded by the health professionals, like distance, sanitize, mask up, and keep the social distance. I think that's all I had. Thank you.